Doctors of Reddit, what is your worst case if I googled my symptoms? Please consider subscribing if you enjoy the video. I had a grade school kid tell me he had a brain tumor. Turns out he put a dry bin in his ear and forgot about it. Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. Not a doctor, but when my fiancé said he was having chest pains and when he breathed, it crackled. I googled and all of the symptoms led to serious illnesses such a collapsed lung. Thought nothing of it, diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. Paramedic student here. Last week we had a call for an imminent delivery. PT started having abdominal pain that would last a little bit and stop, and about 2-3 minutes later would start again. She googled her symptoms and everything she found was saying she was in labor. She called her husband and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurses' station laughing because someone was fully convinced they were diabetic because they were craving water and Webmd said that makes them diabetic. Turns out they are just human and require it to live. Not a doctor, but I had a coworker come into the office with this one. He was having nausea, fatigue, frequent urination and decided to WebMD that shit. We're chatting in the office one day and he says something like, "Yeah, I've been feeling like shit lately, and it sounds like gestational diabetes, but I can't find any cases of men getting it." I just slowly lowered my head into my hand and asked him, "Do you even know what gestational means?" He did not. Actually, I'm a doctor, but this story is from medical school. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. I'm not a doctor, but I'm a medical assistant and I room patients for the doctor. This is in the occupational health field and we had a young gentleman come in who was pretty sure he had a groin hernia according to his Google search. He said he'd been lifting produce crates and experienced sharp, overwhelming pain in his groin. The doctor came back out after seeing him and was clearly fighting laughter by the time he got to the desk. Turns out the kid had chlamydia, which had caused things to become swollen and just happened to get symptomatic while he was at work. Not a doctor, but in 2013 I was feeling awful, shaking, puking/dry heaving, shaking, excruciating and debilitating pain. Went to the had blood work done that I never knew what it said and the doctor told me it was a gallbladder attack. Gave me pain meds and sent me home. 3 days later I was even worse, couldn't eat, couldn't sleep. The only relief I felt was when I was in scalding hot bath. I finally went back to the ER and they did more blood work and told me my gallbladder was septic and my pancreatic enzymes were 6,500 and rising. They should have only been 100-150. And I was dying. I was admitted and when they did my gallbladder removal, my gallbladder was solid black and had 80 stones and a tar-like substance from sepsis. Come to find out the first time I went to the my enzymes were 2,000. I should never have been allowed to leave the hospital. I had a UT, because I had the symptoms and googled it. Day of doctor appointment. It was just a regular checkup, but I asked for a UT test since I explained how I was feeling. Convo went like this: could it be possible to request a UT testing? I've been feeling the symptoms of burning when I pee and some discomfort. How do you feel now? Any pain? Well, no, not at the. Well, if you did have a UT the symptoms wouldn't go away, you were fine. 2 or so days later I get a full-blown kidney infection from a, who would have guessed, a UT. Sent out a complaint. Frick that bitch doctor. I always ask for a test if I am suspicious of anything and I have them documented if they say no from now on. That was a horrible experience. Not a doctor, but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, googled their symptoms while they still had the clarity to do so, and went to the ER thinking they are having a stroke. This confuses the frick out of me. When I go to a doctor they specifically ask if I have done research about whatever, like they expect it. Awkward position, cause if I have researched I feel like an idiot using Dr. Google and having medical student syndrome. If I haven't researched I get the distinct impression nice disappointed the doc. Ever since we studied multiple sclerosis in neuro, I'm convinced I have it, despite my only symptom being paresthesis. Funny feels in my legs at night. Not a doctor. I had an insect bite basically next to my nipple. It was itching like crazy, and my usual bite cream said not to be used on nipples. So I decided to Google what else I could do to relieve it. Found out that apparently no one else has ever had an insect bite on their nipple, but that what looks like an insect bite on or right next to your nipple is almost certainly inflammatory breast cancer. Phoned up my GP. We used to be neighbors, so I kind of knew him, and was in a right state because I thought I had this incredibly aggressive form of breast cancer. He listened to me for a minute, asked a couple of questions and then said, "It's an insect bite. Come back to me if it's still there in 3 weeks. Oh, and try deodorant on it." The deodorant calmed it right down, and it had gone by about 5 days afterwards. Not a doctor, but I was having horrible debilitating headaches for a while. Googled my symptoms and they ranged from stress to brain cancer. Ended up being sinusitis. Not a doctor, but throughout my childhood and teen years I had these weird episodes where I would suddenly have really bad deja vu and get very nauseous. For the next few hours afterward I would feel like I was in a fog and my memory would be shit. Eventually I googled my symptoms and learned they might be minor epileptic seizures. I went to a doctor and he laughed it off and told me it was probably just having panic attacks related to the normal emotions of being a teenager. I was so sure he was wrong that I opted to go get an EEG. Turns out I have a mild form of epilepsy and Google was totally right. Not a doctor, but the brother of the patient. And worse, being on the money. My older sister diagnosed herself as having symptoms of systematic heart failure. Her new primary doctor agreed and gave her some basic guidelines of what to do, and had her visit her cardiologist. The cardiologist poo-pooed her, saying there was probably nothing to worry about and scheduled a test in a few days just to be on the safe side. One of the things her primary had her looking out for was sudden weight gain. And when she woke up 2 days later suddenly 6 pounds heavier, we went straight to the emergency room, who ran tests, including an echocardiogram. Her injection fraction was 12, and they immediately sent her to the biggest hospital in the area, where they ended up saving her life from congestive heart failure. She had had at least 2 silent heart attacks due to the amount of damage they found. Not really related to this topic, but I am a medical student, and recently got sty in my eye. Sty is usually self-diagnosable, but I called up my cousin who is a doctor just to confirm. Anyways, when I was telling this incident to one of my friends, he started scolding me, saying as a medical professional, I should set the example of going to the doctor and getting proper medicines and treatment, and all I could say was, "Dude, I'm becoming a doc." I know how doctors are doctors, especially when they know you're a medical student, tend to overdiagnose or pretend as if we have medical student syndrome. Not a doctor, nor was my brother, despite him thinking his Google fu is a degree, but a couple of years ago my brother decided that since I had been laid off and needed to borrow some money from him to tide me over, that it meant that I was utterly depressed and suicidal. Thus, he deduced that I needed to be institutionalized and took me to a doctor. He lied and said he wanted me to just get a normal checkup since I hadn't had one in a while. I was, I believe, rightly pissed off and embarrassed, but since I needed the money I went along with it. So he decides to just come into the psychiatrist's office with me while she is trying to ask me some questions and see how I am. He starts throwing out terms like maladaptive coping and how I am suicidal and needed treatment. She finally tells him to leave and I speak with her for a bit. Now I was a bit morose because I had lost my job and was embarrassed about asking for help, but I wasn't suicidal and the psychiatrist agreed, stating that I just needed support and not Google fu quackery. I hadn't turned to drugs, stealing or any other illegal or destruction activities to deal with my depression, just that I was a bit withdrawn and down because of my recent low. I went to a doctor one time and he Googled my question in front of me. Not a doctor, but once back in 4th grade, during winter break, I had some sort of illness that made me throw up, sleepy all the time, and a few other symptoms I can't remember. So I was at my mom's computer, and I decided to Google my symptoms since my mom wasn't there. Turns out I had mono, or also referred to as the kissing disease. So after that, I was crying to my mom, hacking my guts out, while my mom tried to calm me down. And to this day, legend has it, I still don't know what I had, and I have never had it again. At the hospital in my town there was a kid who came in saying he had knee pains. The doctor said it was from playing basketball, and 5 months later at a different hospital they found that he had knee cancer and it was too late to treat him. He died a few weeks later. Really sad story. I had 2 separate doctors tell me that I was having panic attacks, when in fact I was having simple partial seizures caused by a lime-sized cancerous tumor in my brain. I got so much as Xanax though. My brother is both the doctor and the patient in my story. Around 2 months ago he had started to feel really tired and ill. Like really ill. He had said to his partner that he felt like he had leukemia, which was of course just kind of shrugged off because how would he have leukemia? He had been suffering with a throat infection for a few weeks and was given antibiotics by a GP at his practice. After a week or so it hadn't helped and he was tired and slightly breathless whilst walking the dog one Sunday afternoon. The next morning he registered himself as a patient and took his own bloods, after being prompted by his receptionist, parents, doctor friend, and sent them for testing. Unfortunately he had been completely correct, and when his results returned he saw that he did have leukemia, acute myeloid leukemia to be precise. He saw the results and knew immediately. As he went to confirm them with a GP next door, the specialist hospital had already called and asked for the patient to be brought into hospital immediately. Unfortunately his hemoglobin levels and general cell count was so low and he was in a really bad way. Many transfusions and 1 round of chemotherapy down, and he is determined to beat this horrible disease. There's a long way to go, but he won't give up and neither will we. I love that guy so much and wish I could trade places with him. There's potential that I may be used as his bone marrow donor. I hope I can be, because anything I can do to help, I want to do. It's not too likely to be me, but I feel so helpless right now, so it would be good to help, I guess. Anyways, no Google, but turns out these doctor guys are pretty damn good at their jobs, even when it's certainly not their specialism. I correctly diagnosed myself with dyshydrotic eczema. The pictures I saw matched the issue I had. Then, I read that there are often chemical triggers. Then, I thought about all of the stuff I had done recently. Then, I remembered the lake in my backyard is full of chemical fertilizer runoff from the surrounding golf course, and I was in it about a week prior. Then, I did it again, because I'm stupid. Then, I got a really bad case of the eczema. Then, I never touched the lake again. The end. Took my 92-year-old grandma to it because it was Saturday. Told them I suspected UT. Doc didn't listen. Finally she had to go potty and they brought a potty chair in. After she was through, the nurse went to empty it. She took one look at how her urine looked and went out and almost made the doc write order for test. Of course it came back as UT. It can be difficult to diagnose a dementia patient because they lose ability to tell doc what's going on. They also become afraid of doctors because they think they will put them in a nursing home or such. I'm not a doctor, but I went to a doctor because I was certain I had delayed sleep phase disorder. He told me I couldn't have a sleeping disorder without being depressed and made me take a depression test. It said I wasn't depressed, so he said obviously I don't have a sleeping disorder. I went to a sleep specialist a few months later and they diagnosed me with delayed sleep phase disorder and helped me get it under control. Obligatory, not a doctor but the patient. Went to the doc several times as a team, complaining of being extremely lethargic. I slept like 13 hours a day. Extremely pale. Cold all the damn time, etc. All classic signs of anemia from what I had looked up. But the doctor said I was overreacting and just being a teenager and refused to even check. Well, guess who ends up back at the doctor's like a year later after an emergency blood test showed my hemoglobin was at like 6.2. Just being a teenager, my ass. Obligatory, not a doctor. I was the patient. I googled my symptoms of hearing loss, tinnitus, vertigo, eye focus issues and headaches. I was fairly convinced I had an acoustic neuroma, a rare benign, but if not treated potentially life-threatening, tumor on the 8th cranial nerve. The end was convinced it was sinus related, but sent me for an MRI on the very slight chance there was something else going on. At this point I mentioned that I had read about the aforementioned tumor and she looked to be stifling an eye roll. It's always a brain tumor when we Google our symptoms, right? The morning after my MRI I received a call from the end and she sounded shook. Not only did I have the tumor, it was as big as a golf ball and pushing against my brain stem. If you know how to do a proper search on the internet, and discern bullshit from truth, you can actually get pretty far. I helped my doctor diagnose my issues by providing him the information I'd found from people similarly experiencing my condition. Without my searching, the doctor would have just sent me home with antibiotics, again. Midwife here, or at least I will be in 2 months when I graduate. Google has its place. It helps people be more informed if you take what you read with a grain of salt and listen to your healthcare provider. Had a young lady last week who thought she might have preeclampsia because she'd Googled it, and based on her symptoms she was absolutely right to come in. We were surprised when the tests came back negative, but she was also very anxious about getting it, so I was clear to her that she shouldn't go home and Google it more because it would just make her anxious. I also always try to give people appropriate websites to go to, so at least that can Google something evidence-based. I googled my symptoms. Turns out I have internet connection problems. Please subscribe if you like the video. It really helps the channel to grow. Adios.